A family history will be getting into the details of the immediate family of the patient, which will be initially the parents, the mother and the father, then also the siblings, brothers and sisters, will be the initial family history, first generation. There's a prolonged family history which probably may not have that much of a bearing on the medical history of the patient. Initially stay with the parents, but we do get up to the grandparents. We do want to know what kind of chronic diseases they have. Family history is getting into your parents' history, especially things which are mostly related to hypertension, diabetes, and most of the cancers are gene related. A lot of them may be personally related, but they are gene related cancers. It's very important to find out from the family what kind of histories they have. So with the now availability of genetic studies, we can see if you are carrying those particular vulnerable genes, so you can be screened earlier and give you the protection, earlier detection. The problem with the family history is that even if your parents have the particular disease, it does not necessarily mean that everybody will get the disease, because even if you have the same gene that predisposes you to certain cancer, there is a gene presentation. Not everybody who has the gene will get the disease. You need to make sure that you have lifestyle changes are made early, screening early, avoiding risk factors that predispose you towards those type of cancers. For example, utilizing hormonal medications might predispose you earlier to a breast cancer. Similarly, colon cancer has been found to excess amount of red meats, especially grilled type of red meats, and also excess amount of saturated fat is also involved in colon cancer. So you have to modify your lifestyle so that you decrease your risk factors in addition to a strong family history. Physicians need to know the family history because that gives us an opportunity to find out what type of screening things we need to do in the patient and at what age we need to begin to do that, so we can tailor these screening procedures to the patient. The screenings that are done earlier in somebody who has, for example, breast cancer, a lot of breast cancer is related to the genes, which is the BRCA1 and the BRCA2, and it is very important to find out if the parents are BRCA positive, that we need to do the BRCA testing in the patients as well, because if they have a BRCA gene, 1 or 2, their chances in a lifetime of developing breast cancer is almost 85%. Also, instead of doing at 45 years of age, the screening starting for mammography, we may start earlier at age 40. The family history of colon cancer is also important because there are certain syndromes which are, for example, the Lynch syndrome is a very genetically related. If any of the parents have a Lynch syndrome, they are definitely will be able to pass the gene to the family, not necessarily 100%, but it can be tested, and we do a colonoscopies in these people starting as early as 40 years old. The first thing to do as far as family history of hypertension is to modify your dietary habits. Sodium is found to be one of the biggest contributors to elevated blood pressure, and in general most of the Western diets seems to have excess amount of sodium than what is necessary, purely out of modified tastes for so many generations that you have been eating. So we'll reduce the salt intake. Next thing seems to be definitely the weight has a lot to do with hypertension. So avoid obesity and control the weight. And if they are obese, make attempts to lose at least 10 pounds of the weight. Also, alcohol seems to be related to hypertension, and nicotine also seems to be related. So modify those habits as well to protect you from hypertension. Family history of diabetes is also very important because they are finding out there's a lot more genetic reasons for diabetes. Family history is important in the sense to evaluate if you have a family history of diabetes, with studies, with both genetic studies as well as your glucose tolerance, and especially for long-term glucose management such as hemoglobin A1Cs, which can be done earlier to see the trends if you are getting possibility into impaired glucose tolerance, and to modify your lifestyle at that point to protect you from eventually getting diabetes.